Sir, what about prostates?
बहुत अच्छा क्वेश्चन भाई सिंह साहब आपने पूछा.
Please, sir. Please, sir. Please. English. English.
Okay, well, as you have asked me regarding prostates,
Yes, sir.
means enlargement of prostates. Mr. Singh, this is an aging problem. Male persons suffer from prostates. These are glands. These are glands and are located between penis and the urinary bladder.
Yes, sir. Yes, sir.
And these glands secrete a kind of fluid which nourishes the sperms passing through the urethra. And then that fluid is called semen. But the main thing is to discuss here is prostates. What happens when these prostates get enlarged? The enlargement of prostate causes some problem in male persons. That is, what symptoms enlargement of prostates causes, that I am going to discuss. Number one, there is a increased frequent urination, more at night. There is difficulty in urination. Patient may feel pain during maturation, and sometimes patient complains me that he feels difficulty in passing the urine, and urine passes drop by drop. And next, he feels unsatisfactory emptiness of bladder. Urine remains there in the bladder. So because of that, he feels heaviness in his lower abdomen, that is in pelvic region. So just to diagnose whether the patient is having enlarged prostate or not, he is advised to go through ultrasound. And ultrasound will reveal whether the enlargement is there or not. You know that the average weight of prostate is from 9 gram to 17 gram.
Yes, sir.
It varies. The average is 13 gram. But if symptoms are not there in the patient, then we considered it to be normal up to 20 grams, that. So, that more than 20 grams, it is said to be in first stage of enlargement.
Okay.
So, it has 4 stages. First stage, second stage, third stage, fourth stage. The fear is there is that if it crosses second stage, then sometimes there may become the chances of cancer, malignancy.
Okay, sir. Yes, sir.
Yes.
Yes.
So one must go through ultrasound, and if the patient is running in third stage, so he is advised to go through a test also, blood test, that is called PSA, prostatic serum antigen. So it reveals whether the patient is or his prostates are malignant or not. And so that these two tests are very much important for the persons who suffer from enlargement of prostates. And sidewise we advise urine test also. urine routine examination, urine culture, to see whether there has already developed an infection or not in urinary system, that is called UTI in short. So हाँ, so जो है and as far as treatment of prostate is concerned, you know that it is a surgical case, no doubt. It is a surgical case. But if the patient reaches the doctor in early stage of enlargement, then the condition can be relieved by allopathic medicines also, by homeopathic treatment also. One thing I would like to tell you, Mr. Singh, there is a complete cure of enlargement of prostates in homeopathy. No doubt, I have already said that allopathy has also got very, very good treatment for the enlargement of prostates. But when it crosses second or third stage, then surgery is required. One should not fear to go an expert, that is urologist, for the advice. If he advises operation, the patient must go through. You know that. So it is always necessary that one should go on every 3 months, once in 3 months, for ultrasound to check whether his prostates have become enlarged or not. You know that, and the patient should be aware of lest his prostate may become malignant, and that will be really a dangerous condition, you know.
Yes, sir.
So, so one should not be prejudiced whether he goes to allopath or homeopath. You know that I have some idea about, I being a homeopathy doctor, I have some idea about allopathy, that in allopathy there is treatment. There is the medicinal treatment is also there, surgical treatment is also there, and in homeopathy there is complete cure, that one should consult a very competent homeopathy physician for the treatment. I hope that you know that myself is a diabetic patient for the last 38 years. I am the patient of hypertension for the last 27 years. I am the patient of enlargement of prostates for the last 20 years. I am 63 plus now, you know. So I am on homeopathic medicines. 1 month back I got my ultrasound done, and my prostate weight was 21 gram, you know. But in the beginning it was 25. Medicines helped me a lot. Lot of medicine are there in homeopathy that can be used by an expert, you know. So, you know, this is all about prostate, and I think that one should not be afraid of it, but he should be careful. He should consult as soon as he feel any problem, any difficulty in urination, urine passage drop by drop, or any other problem. He should go to his doctor, his physician, whether he is MBBS or BHMS or any expert urologist. He should go to meet him very soon, very, very soon, Mr. Singh.
Okay, sir. Thank you.